Hello, good evening, everyone. Welcome once again to today's session at Let's Discuss Wednesdays. Well, as you know that I'm here today with a very interesting thing. I will give 10 pointers to you all, with which we can justify or understand why we should really get into something called as dental genetics, or rather why the importance of genetic understanding is implicated in dental perspective. Okay, so not wasting much time, I'll just get in and let me see what I have in my bag to give you. Okay, so I hope you guys can see. It takes some time to get the all right. So I hope you were able to see. And if you are here, as usual, you have to give me a hi. So before starting, let me introduce myself. Though many of you know me, but still I'd like to introduce myself for all of my new members. So I am Dr. Gargi Roy Goswami, an interdisciplinary oral healthcare professional, a geneticist, and a general dentist by profession, and an academician by passion, and a scientist by heart. So, with that, and with the mission to create, collaborate, and contribute of science, we have this platform called as Indian Academy for Clinical and Dental Genetics, of which you are all wonderful and very, very precious members. So, let's go into Let's Discuss Wednesdays. And today we are trying to understand the big why. Why do we talk about dental genetics and why actually you all are here in this platform? So I will give you now 10 pointers on why dental genetics. Let me see if I can really justify myself. So, first of all, the pointer one, if we see from the simplest dental disease like dental caries to the most complex one, like we know about oral cancer, or there is a condition called as tooth agenesis where teeth doesn't the normal number of teeth doesn't happen, and sometimes that, I mean, that's very rare, but sometimes there is no teeth, no development of teeth. Then you know about cleft lip and cleft palate. So these are all birth defects. And also very frequently we see about the crowding of teeth, that is malocclusion that we call. And apart from that, the most common gum diseases. So there are many scientific literatures where we know that all these diseases, starting from a simple dental caries to a complex one as a cancer, has a genetic factor contributing to all the oral diseases. So that is why dental genetics is important. So, like for example, even if we try to understand all these things, if you have attended the tooth story session, you will see that we were talking about starting from a fertilized egg and then moving on to different stages and coming to tissue differentiation, not and then specifically focusing on the tooth formation into different stages. So all these things have genetic elements each and in everywhere, in every sphere. So that is why, just to understand the genetic mechanism, the factors behind this, it is very important to understand the genetic perspective in dental conditions. Going to the next pointer is to ability to construct a three generation pedigree. Sorry, the pointer reads the three general, it will be three generation pedigree, which as dentists we do not know. Even all geneticists do not know. So don't worry. So basically I will explain this to you with an example. So the ability to take family history is very important. The way we understand and take family history is just a verbal one, or we write it, but it has a specific uh, you know criteria. It has a specific schematic representation. So what I can tell in a simple term is that pedigree is something, the schematic representation of the generation, at least 3 generations we do, to try to understand exactly what is the origination of a particular dental disorder, which is very, very important. You will see how I will try to explain you with an example. Like, for example, you might have heard about or read about dentinogenesis imperfecta. So now, this dentinogenesis imperfecta is a condition which can occur just as dentinogenesis imperfecta, that is isolated, or it can be a part of a syndrome. The most common syndrome is osteogenesis imperfecta. So, osteogenesis imperfecta, if a person or a family has a history of osteogenesis imperfecta, so there will be, history of hearing loss in some of the members. There will be a history of very easily getting hands or arms or legs broken. So what happens? Sometimes a misdiagnosis happens, because, as you know, that there might be there are different types of osteogenesis imperfecta. So, for example, if I diagnose mild type 1 osteogenesis imperfecta as isolated dentinogenesis imperfecta. So I am missing out actually the family history, because just by looking these two pictures, as you see, it looks so very similar. So I'm not considering uh, the main factors, general factors, that is bone fragility or hearing loss, because I'm not trying to get that history out of the patient, and patient will never come and tell you things. So if I have a proper calculation and a scheme to represent all these things, where I can just, if I go back to the slide, if you see all these black circles, some lines, some 1 2 3 written, so all these has meaning. I'm not going to get into pedigree right here now, this is out of context, but this is what, very within 5 minutes you can draw pedigree, and you don't have to write each and every sentence. So that's powerful it is. So ability to construct a generation pedigree to make a proper dental history is another important reason why we should understand what is dental genetics and why should we get into this particular area. So uh, coming to the point at 3, making a correct diagnosis. So here I will tell you a very unique example. Now there is a syndrome called as enamel renal syndrome. Now this occurs in a particular, due to mutations in a particular gene, I mean changes in a particular gene. That is what is written here. So what happens is, when as dental dentists, when we see that this syndrome has particularly features of amelogenesis imperfecta and gingival hyperplasia together, and when these two together, we see there are classical features. I'll take you to the next slide, where it is very much suggestive of this particular enamel renal syndrome. So it is not just that by seeing a oral diagnostic, the oral diagnostic criteria will be so many are there over here, as you see it's written. So it might give us an impression that it is just amelogenesis imperfecta, but no, this would be enamel renal syndrome. And here one thing I have marked in red in this example is that if you see this diagram, this is clinically, this is a USG of the kidney of a child patient, where this this is called as nephrocalcinosis. If you see my cursor moving, this kind of patches. So these are actually nephrocalcinosis, which there is generally no symptoms clinically when the children are affected by this particular syndrome. So taking you to the next pointer with this particular example, again, you will understand why we need to know dental genetics. So pointer 4 is making appropriate referrals. Now taking the similar example, let me go back to this slide. So when I understand, okay, if I have the knowledge, okay, when I see gingival hyperplasia, when I see classical features of amelogenesis imperfecta together, then if I have the knowledge, only then I will tend to make an appropriate referral to a nephrologist, because I know that generally in children, this is asymptomatic, this syndrome, enamel renal syndrome. Now, you might argue with me that, okay, this is not common, but you never know what is not common and what is common. And that one day might be that you come up with this kind of a patient. Okay, so the the fourth point is that fourth pointer is making appropriate referral, because as dentists we are not going to do the USG that I showed you, because in this way you are actually saving the life of that particular child, because once it is diagnosed with the USG, then the nephrologist can do follow up and it can evaluate the child's kidney function, so that before it goes to renal failure, the child can be saved. So that's very important. So that is point number 4. So point number 5, a very interesting thing I will share now. In-depth understanding and correlation. Now, if you see here two pictures, so the left one is says oligodontia, that is, you know what is oligodontia, right? And right one is, it shows the different stages of colorectal cancer. Now, this is just an example, just to make you understand how important the knowledge of genetics is. So, if I have in-depth understanding, at least to a certain extent. So what will happen is that, for example, see here in the slide is that there is certain gene mutation which is common for both oligodontia and colorectal cancer. Again, going back, see, all these are interrelated. We just cannot set the pointers, separate apart. But I'm just trying to give you an overall view in sections with these pointers. So if I know that there is something, some gene mutation happens, which is, again, I know it happens in oligodontia, so that person might have a condition, or a feasibility to get colorectal cancer, or it might be suffering maybe in the very initial stages. But then I don't mean that every oligodontia patient has to have a colorectal cancer. It's not like that. But the thing is, if I know this, if I have this knowledge, if I have this particular knowledge, what I'll do, I'll when I see a oligodontia case, I will, after my dental diagnosis or whatever has to be done, dental counseling, whatever has to be done to the patient, I will definitely put one line of reference to the specialist who would be dealing with colorectal cancer, maybe. Okay, so that's important. That's very, very important. Um, Number 6. Now, I think we celebrated DNA Day, and that day, one of our members, Rajshri, told us so many things about Human Genome Project. So now, we know what is there. I mean, how many genes are there, and it's daily, it is increasing. So accordingly, we have many different genetic tests. But unfortunately, the dental fraternity is, not everybody I'm telling, but mostly, with few exceptions, are not aware of this kind of genetic tests. So the number that I have highlighted here is 3,000 genetic tests, and probably this has increased a lot, because this information is some 1 or 2 years back that I've put up. So genetic tests are wonderful things, and to understand when and to decide what genetics test I can refer to my patient, or when or what kind of patient I should refer to for genetic, is not that somebody coming in and I refer for a genetic test. It is not like that. But then that evaluating power and deciding on which test I should go about is another very important aspect that can be implemented in clinical scenario, and it is very important when, particularly, I'm talking about cases when when it comes to decision making areas of cancer, taking it to radiotherapy, whether you want to take up surgery. So that kind of um, that kind of information you can get from genetic tests, apart from susceptibility or predictability or tests or whatever. Okay. Number 7, to look for genetic resources. I'm sure this was thing which was continuously going on in your mind when I was talking about, okay, the few pointers, and I gave example of Enaman-Reynolds syndrome, I gave example of colorectal cancer and correlation of the same genetic mutation in oligodontia. So you might have been thinking, okay, for this I just cannot become a geneticist. That's not possible. But as a professional, as a healthcare professional, we must be able to look for genetic resources. So you might be thinking, okay, always I need to go and refer to an expert. Not at all. You will not believe that after this completion of Human Genome Project, whatever data has come up, like whatever possible genes, whatever possible diseases that are there, these are all available on the internet free of cost. And these are called as biological databases. So now, because of lack of education in genetics, we as dental professionals, to be very honest, whether you agree with me or not, but I can just put it like very straight that it isolates dentistry from other healthcare disciplines. Now, when if I have resources available, I just need to put in that knowledge so that I can find those information and it's available. Like for example, I have put up some names over here. If you see DNA database, RNA database, stuff like that. So all these are available. What gene you want to know, what dental condition which are already, what are, I'm not talking about rare ones, but most common ones. Go to these databases, find what are the genes involved. You can read about each and every aspect of that particular gene, what kind of protein it forms. So that goes to protein databases. I mean, it's a huge ocean of knowledge, huge world altogether. So if we develop this kind of information, if we are able to look for genetic resources through these databases, then definitely slowly, if we are looking towards a personalized medicine that we talk about today, and in the future, when genetic medicine is the only say, which is coming up even and which has boomed in India even, so we will be very easily a part of that. So just think whether dental genetics is required or not. Okay, so coming to the pointer number 8, you all know that we need to develop a holistic understanding of disease mechanisms. Like, for example, take the periodontal disease, the most common gum disease. So it is not only about the oral hygiene or the microbiology or other deleterious habits, it is also about the genetic and epigenetic landscape. And as dental professionals, we have to understand, we just cannot tell that we don't know. Whether I am a general dentist, whether I am a specialist, I am supposed to know at least the basics. I'm again stressing on that I don't have to be a geneticist as big as a dental professional. Minimum knowledge about the diseases daily that I deal with is enough to take me forward and develop a holistic way of understanding and give a better treatment and plan. And because once you gain these knowledges, your thought process will also change and you can think in a better way. You will do diagnosis in a more better way. So that was pointer 8. Coming to pointer 9 is to communicate with non-dental experts. I feel this is one thing from my experience and hearing from several of my fellow dentists, students, researchers, faculties, professional, however I put it. So what happens is we are enthusiastic to do something, but we have to depend on others. Well, that's obviously we have to do. Like for example, I want to find out, do a study, okay, with some population of my patients and some samples I have. But when I have to talk with the laboratory person, I really don't know what to do. Or if I have, I'm just making generalized comments. There are people who, dental professionals, who are into, who very well know all these things, but still I'm trying to give you a general scenario. There is no intention to demean or dishonor anyone or anything. So coming to this is, what do I mean by non-dental experts? One is communication with the technological laboratory that we want to work with. Second is genetic counselors. See, it's very important. It's very important to make them understand what we want, because even if, like, you go and send your patient to a genetic counselor, uh, when they give you the feedback, I mean, the genetic counselors tells you something. If we do not have a basic understanding, we will not be able to connect. So, point number 9 is to communicate with non-dental experts. So you need dental genetics again. And last but not the least, the point number 10 is to find out solutions through upgraded research. Whether today you talk about coming up with a caries susceptibility test with blood, with saliva, or whatever that you can think, or for any other dreadful disease like oral cancer, if I am supposed to come up with some solution, if I am thinking, then I need a knowledge base. I just cannot depend on some other person and influence my thought process. It's not possible until and unless I have that kind of knowledge, or I develop skills, at least the basic ones. So that was all the 10 pointers, and I hope I could justify why dental genetics, or rather what is the importance of understanding of genetics as a subject or as a area in dental dentistry. So if you are overwhelmed with my session, or if you have really liked it, and if you have certain questions, go straight down and write into the comments. And don't worry, just write it down. And all right, so thank you so much for being always with me whenever I come live. It is actually inspiring for me when I see you present here. So with that, I have an announcement to make. I have announcement to make. So the announcement is that I am thinking, or rather, we are thinking to bring up a small contest so that we stop losing our creativity in this grave time. So a contest on similar one that I did in my international conference of saliva symposium this year. So the contest is on finding out a solution for COVID-19. Okay, I will post more details about it. It will be sharing, you will be sharing your innovative ideas, and let's see what comes up. To be very specific, a correlation between COVID-19 and dental professional or dentistry, and what you think would be the most important aspect with COVID-19 that when we resume our practice would be used as a tool. So what would be that solution? So just start thinking, and I will give out more information on this. So that was what about the surprise announcement. I hope you enjoyed, and bye.